Welcome back. Joining me this morning is Shawnna Rhine from the Southern 7 Health Department, here to talk about genetic cancer testing. So first and foremost, what exactly is genetic cancer testing?
Sure. Genetic cancer testing is basically a test that looks for mutations in your DNA that put you at risk for developing certain cancers.
Interesting. So this is super important to have something like this. How vital is this for someone?
Well, it's very important, especially if you have a cancer history in your family or yourself, you've had a cancer history. It's a way to look and see what mutations that you have to determine what cancer treatment you need, maybe earlier screenings, for example, for colon cancer. And it's also important for your children and your grandchildren and other family members, because if you have a gene running in your family line that needs to be looked at, it's a great way to prevent cancer down the road.
Oh yeah, most definitely. And this isn't a new program for Southern 7. How long have you guys been offering this?
We've done it a year this month.
Okay.
And what we are finding so far is kind of what we were concerned about. The national average of positivity for this test is about 10%. We see right now about 17%.
Oh, wow.
So of those individuals that have taken the test and have tested positive, they're going on and talking with their doctors about first screenings, and cancer is being prevented.
Wow. And so you guys are trying to raise awareness that you guys have this program and that people can get started on this. What does that kind of look like? What does the testing look like for it?
Well, the testing is a very simple blood draw or saliva swab. It takes about 2 to 3 weeks to get your test result back, maybe just a little longer. But what we are seeing is that because we have such a high incident rate of cancer in our region, which we've talked about numerous times, we wanted to see, is this something that we're seeing throughout the state?
Right.
So we are expanding this program to 6 other health departments in the state of Illinois.
Wow.
And once we get those 6 established, we will take the testing into those regions and see what it looks like there. We're also expanding the program to focus on ovarian cancer because there's no screening for ovarian cancer. So through our partners in our colon cancer program, which are the Hope Light Foundation, University of Chicago, and Penn State, we're bringing those folks on board. We're also bringing Aetna Health on board, which we're very glad to be doing so, and we are expanding this program and hopefully making a difference for folks throughout our region.
Yeah, I could imagine that having those partners involved only gets the awareness out more and allows more people to do this program. So how many people have been tested through the program?
As of last week, roughly 72 people have been tested. And people look at that and go, okay, well, wait a minute, that's not a lot of people. But even a small number like that is indicative of our region.
Yes.
We found that with our at-home colon cancer program. So it is giving us a snapshot into what we're seeing here at home. Genetic cancer accounts for about 13% of all cancers. But if you're someone that's also overweight, you smoke, you drink, you have other unhealthy habits which attribute to cancer, that's just increasing your likelihood of it.
And so then how can people go about getting this test, and what does that look like?
Sure. Well, very simply, you can visit our website at southern7.org. You can also give us a call at any one of our 7 health departments in the lower state of Illinois. And you don't have to be an Illinois resident to do this. We have people from throughout the country that participate in our programs. So even if you live in Southeast Missouri, give us a call and we'll get you tested. You do have to do it by appointment if you do it in one of our clinics. But if you come out to one of our WOW Van events, you don't need an appointment to do it there.
And then is this something that's covered by insurance, or what does that look like?
Sure. For most part, yes, it is covered by insurance. You just need to check with your insurance provider to make sure it is covered. And there are ways that we can help you to make sure that you cover that cost. We can talk to you about that during your visit.
Yeah, and so then for people who maybe think, I don't want to know that.
Yeah.
There's probably quite a few people out there that think like that. But, this is being offered. This could potentially prolong a person's life, help save your life. Talk a little bit about the importance of that.
Yeah, genetic cancer testing is not new.
Right.
Our doctors are starting to talk to us about it. I got tested, and I was scared too. Nobody wants a cancer diagnosis or anything. But I went ahead and did it because I had early stage breast cancer when I was 41. So for me, I did it because I wanted to make sure that if I was a carrier of that gene, that my daughter could get screened earlier, that my son would understand that he could be a carrier too. Fortunately, I was not. But if I knew that, then that's something to get taken care of. And cancer is one of those things that we're seeing right now. If you can get a hold of it early,
Yeah.
your chances of surviving are extremely high. And so this is just one of those things. Again, your doctor's going to start talking to you about it.
Yeah.
And I want people to know, we want people to know this could save your life. It really could.
And then they can find more information about this program on Southern 7 Health Department's website.
Right, southern7.org.
Okay, southern7.org. Awesome. Well, Shawnna, thank you so much for coming on this morning to talk a little bit about that. That is super interesting. If you guys are interested in learning more, definitely head on over to their website and give them a call. They can be of great help for you to get all of that information. We'll be back in just a bit.